Hello, and welcome once again to HDtv Health District Television, brought to you by the Southern Nevada Health District. I'm Brian Gresh. Over the last 2 years, the shock of mass shootings by troubled young people in Tucson, Aurora, and Newtown have focused the national spotlight upon mental health issues, while government reports continue to document the troubling state of children's mental health services delivery in the nation's communities. In addition to the difficulties faced by our own community's failing service system, Clark County children with behavioral health needs and their families have suffered more than their share of stress from the consequences of the economic recession, which affected our region more than any other during these recent years. That was an excerpt from the 2013 status report prepared by the Clark County Children's Mental Health Consortium, submitted to the state's Department of Health and Human Services. It serves to illustrate Southern Nevada's awareness of an issue currently prominent in the national dialogue.
For a number of years, I've been representing the health district on the Clark County Children's Mental Health Consortium, which is a legislatively created group that's for at least a decade now. And they were specifically to look at children's mental health issues. There's a consortium in Clark County, one in Washoe County, and a rural. And it's a whole host of different people that represent different factions in the community, service providers as well as other people from juvenile justice, from the school district, and again from the health district.
The consortium's goal is that by the year 2020, children and families in Clark County will have timely access to a comprehensive, coordinated system of behavioral health services and supports. In these challenging economic times, that's a lofty goal. But steps are being taken to reach that goal. For example, under the Affordable Care Act, better financial access to mental health care is a feature. In addition, during this current legislative session, one of the consortium's recommendations may come to fruition.
Each year the consortium as we do a report, we're required to send up priorities for budgeting purposes, and many times there's not enough funding, but one of the priorities that's been sent up for at least the last 7 years is the mobile crisis units for children. It's going through the process now in the legislature and the governor's budget, and hopefully it remains in the budget so that they can provide mobile crisis services for youth, which we've never really had that here in Clark County.
Mobile crisis units could provide screening for at-risk children and identify their needs at a very early stage of mental health issues. Catching problems early has also been a focus of the school district.
The Clark County School District, which is a part of the consortium, has developed, they did a pilot project 2 years ago, and they're continuing with we call the SOS is Signs of Suicide. It is an evidence-based program recommended by Suicide Prevention Resource Center. They initiated that program, and through that they're screening and educating students in middle and high schools. And it's a combination of the school's counselors, the nurses, the threat assessment team, and the social workers in the school district are working together. And I believe the first year they actually ran about 9,000 kids through this program.
Improving our children's mental health is going to take a community effort with support systems for parents and guardians.
There's a lot of times where the parent looks at the fact that if my child breaks their arm or has the flu, I mean, that doesn't reflect on me so much being a bad parent. Those things happen. But if my child has a mental health issue, it must be because I'm doing something wrong. That's one of the key issues.
And while health educators like Bernstein and his consortium colleagues work at removing the stigma attached to mental health issues, parents identifying a situation need to know where to turn for help now, as the system currently exists. One option is to call the Department of Child and Family Services, who can provide some referrals for those seeking assistance. Another is Nevada PEP.
Another good place to is going to Nevada PEP, which is a statewide organization which knows how to get around a lot of the obstacles in getting treatment. Again, they can't, I'm not saying they're going to provide every treatment, but they probably, to my knowledge, as a member of the consortium, have probably the most knowledgeable people about what is available given the condition that you present. It's parents encouraging parents. These are parents of children who have emotional issues, who've been through it before and have gotten help. And many of these people have been so impressed with doing this kind of stuff that they've been trained, and now they work in this organization to provide information to other people.
Nevada PEP can be reached by calling 388-8899 or on their statewide toll-free number 1-800-216-5188.
It's not just throwing money at it, it's using the money in an efficient manner. It's not, just money helps, yeah, of course, having more money to provide more services, but it's also, making the system more user-friendly.
Finding the funding and making access to mental health services more user-friendly remain a top priority, not just of public health officials, but by Nevada's elected officials as well. We'll keep you updated on any legislative developments in future episodes of this program.